If you are pregnant or trying to become pregnant, you may have wondered, what should I do if I was drinking alcohol or taking drugs before I knew I was pregnant? Where can I find resources for people who need help quitting drugs? Or which prenatal screenings do I need? Many women have these questions, so you are not alone. After all, pregnancy can be very complex. At Emory's Center for Maternal Substance Abuse and Child Development, we encourage all women who are pregnant or thinking of becoming pregnant to talk to their doctor about substance use during pregnancy. As part of our 2021 campaign, Keep Your Provider in the Know about drug and alcohol use during pregnancy, we are providing tips on talking with your provider. Making the most of your prenatal visits is important to make sure you receive the information and care you need to best protect you and your baby. Here are a sample of questions you can ask your provider during prenatal visits related to alcohol and drug use. The first question you can discuss with your healthcare provider is, what should I do if I was drinking alcohol or taking drugs before I knew I was pregnant? The most important thing you can do is stop using alcohol or drugs once you know you are pregnant. It is never too late to stop drinking. Because brain growth takes place throughout pregnancy, the sooner you stop drinking, the better it will be for you and your baby. If you are having trouble stopping or addicted to a substance, talk to your healthcare provider if you need help quitting any of these substances. There are ways to treat substance use disorders during pregnancy. Your healthcare provider can help you decide the best course of action for you and your pregnancy. Depending on the substance, stopping cold turkey could be dangerous for both mom and baby. If you drink any amount of alcohol while you were pregnant, talk with your and your child's healthcare provider as soon as possible and share your concerns. Some of these substances can affect your pregnancy and your baby's development, so it's important for you and your provider to talk about it, even if you are just an occasional user. Also, make sure you continue to get regular prenatal checkups. Some issues may be able to be seen on an ultrasound depending on how much alcohol you were drinking or how many drugs you were using and when during your pregnancy, but many won't. Figuring out what issues a developing baby could have at birth or later in life may be important. Babies and young children can be evaluated if they are missing developmental milestones in order to see what treatment or support options are necessary to help them succeed. Not every baby exposed to alcohol or drugs during pregnancy will have issues though. Additionally, you can use resources such as Mother to Baby Georgia to learn more information about how alcohol and drugs can impact a developing baby. Experts at Mother to Baby Georgia can be reached by email, text, phone call, or live chat online to address concerns and questions. Another question to discuss with your healthcare provider is, where can I find resources for people who need help quitting drugs? The following are great resources to find help quitting. In the state of Georgia, the Georgia Crisis and Access Line can be contacted at 1-800-715-4225 or at mygcal.com. There's also the National Helpline run by SAMHSA that can be reached at 1-800-662-4357. And you can also find more information about treatment centers at findtreatment.gov. In addition, your healthcare providers are also some of the most beneficial resources to discuss your alcohol, tobacco, or any recreational drug use. And you should discuss any help you may need quitting these substances or treating substance use disorders, especially during pregnancy. Another question to discuss with your pregnancy provider is, which prenatal screenings do I need? Prenatal tests are medical tests you get during pregnancy. They help your healthcare provider find out how you and your baby are doing during pregnancy. You get some prenatal tests several times during pregnancy at your prenatal care checkups. These include things like blood pressure checks and urine tests. Other prenatal tests, such as an ultrasound or special blood tests, are done less often, but are also tests to make sure you and your baby are staying healthy. There are other tests that are done at certain times during your pregnancy. These prenatal tests check to see if your baby has any health problems, including birth defects or genetic and chromosomal conditions. Talk with your provider about which prenatal tests are right for you. For more information on prenatal screenings, you can visit the March of Dimes website. This message is brought to you by the Center for Maternal Substance Abuse and Child Development with the support of the Georgia Department of Behavioral Health and Developmental Disabilities. The Center for MSACD's prevention program focuses on the prevention of prenatal exposures and the negative consequences of maternal substance use and/or abuse by providing a range of prevention services to agencies, communities, and families across the state of Georgia. We offer trainings, workshops, free materials, and other informational services concerning prenatal exposure to alcohol, nicotine, illicit drugs, and prescription drugs. For more information, please visit our website at msacd.emory.edu.